The holster, you're seeing the lanyard. And are these already put together for you guys? Are they sending them out that way? Okay, good. That's great news.
They accidentally threw away the extra supplies. OR. Like the extra Tegaderm.
Like this?
Yes, they throw all that away.
All right, so there is a Prevena bag like this that comes in the box with them. So for them to put the extra strips. So if you have these, send them with the patient and let them know if they do have an air leak, these are pieces that they can use. If you guys have those, you can use that. You can use Tegaderm, works just as well also. And then the other thing that's really important, actually two things that are really important to be in here. This booklet is a patient guide. It's designed to help the patient when they get home and help answer questions. Talks about showering and that kind of stuff with it. Also talks about kind of what they're seeing on there. And there's also, if they do have an alarm, what to do. There is also, and if you would just point this out, it is on the back. There is an 800 number on the back. Hey, how are you? An 800 number that they can call 24/7. They can call that. So if it's 3 in the morning and they have a question, they can call that 800 number to get answers as well. And then this is in English and in Spanish. So we have both there. And then the other really important thing is this power cord. Please make sure that should be probably the first thing, because if it's not there, we need to get to the OR and before they throw it away. So the power cord should be there. The other thing too, I'll just make sure everybody knows the power cord plugs right in here. They want to handle the power cord and charging this kind of like you do your cell phone. A full charge is going to give you about 10 hours. So if they're sitting, if they're sleeping, just have this plugged in, and then when they're up and ready to go, then they can be free to move around. The lanyard is designed to be carried over their shoulder. It can go crossbody if they want. There is also a belt clip here that they can clip on their belt, just depending on what seems to work best. I want to talk just a little bit about, well, let me show you this real quick. This is a new trick that I just found. So these little pieces on the back here, if you take this cord, because the cord can get pulled away and it can cause an air leak. So you want to make sure that anytime you have an air leak, that that's pushed all the way down. We'll talk a little bit more about that. But if you just tuck that cord underneath there, it just kind of helps prevent putting that pressure on that. You can also, depending on where their location, their surgery site is, you can wrap it all the way around and come up this way too, just depending on kind of what's convenient for them. Someone else told me yesterday that what they like to do is they've had some where they have trouble with them falling out. I don't know if you've had issues with that. That's the first time I heard that. But they said what they do is just tuck this cord underneath here, and it kind of just gives that extra piece of security, so it kind of locks that in. The first time I've heard that was yesterday, so I'll throw that out for you if that makes sense to you. But want to talk real quickly also about the canisters, the extra canisters. One piece of what Prevena does for their incision is collect drainage. Some patients will never have any drainage, and that's perfectly fine. Not an issue at all. It is still providing lots of benefit to their incision. So if my mom had one, she had her hip done here last year. She was like, it's not doing anything because there's nothing in the, Mom, it's doing so much more. That's just a little small piece. Don't worry that there's not. However, we also have those patients, and you've probably seen them, where you go through a canister like in 5 minutes. So just be aware of that. I think you guys are going to start sending them home with an extra canister. I think that's fabulous. One thing I will tell you, when you do open one out of the box, it's in like a little hard shell thing. The tubing is not attached to the canister. So what they're just gonna have to do, they're just gonna push it right here. It only goes one way. Make sure that you're pushing it all the way down. You'll kind of feel that engage in there. And then when you put it on the back, you put it kind of at a V shape, kind of like this at the bottom. So there's a little place for it at the bottom, and then you'll hear that click as you pop it in. I would make sure you're letting the patients know how to do that. So in case they do have that trouble, just how to change that. This is a closed system, so what they would do they do have a full one, they're just gonna dispose of it in the trash, okay? And then they're gonna take their other one and pop it in. I would say that if they do get another one and they're still having lots more drainage, they should probably be reaching out to their physician office so they can start the process of maybe getting another one. Like I said, some people go through many, some people don't go through any. So it's just, and you never kind of know. Even patients that have been in the hospital, I find some, they're like, they didn't have any drainage, while they were here, and then they go home and they have drainage because they're moving around a lot more. Okay, I want to talk real quickly also about some troubleshooting tips.